exhaustion, and fatigue. Even though you've slept a long time, you still lack the energy to do even the simplest things. What if I told you that this tiredness is more than just a phase? It could be the first warning sign of something bigger. From invisible stress that drains your body to serious health issues that you can't ignore. If you recognize these symptoms, this video could be the turning point that you need to get your life back on track.
My name is Dr. Berger. I am an endocrinologist, diabetologist, and gastroenterologist, and I have been treating people with diabetes and hormone disorders for over 25 years. So now, without further delay, let's get started with this exciting video.
In this video, you'll learn today, what do fatigue and exhaustion mean, and how can you tell them apart? What underlying causes might be triggering it? From vitamin deficiencies to chronic illnesses, and how to recognize warning signs before it's too late. In the end, you'll get practical, proven strategies to help you regain your energy. Stay tuned. The answers you're looking for might be waiting for you right here. What do fatigue and exhaustion mean? Fatigue is a state that everyone knows, but many underestimate. But did you know that tiredness can be much more than just a temporary feeling of being drained? Are fatigue and exhaustion the same? Fatigue is the feeling of weakness or physical exhaustion that can be triggered by lack of sleep, overworking, or physical exertion. It can be mental or physical, or both. Exhaustion goes far beyond fatigue. It's a chronic state of weakness that doesn't go away even with enough sleep or rest. Exhaustion often points to more serious emotional or health issues. The crucial question is, are you ready to understand these differences and take responsibility for your health?
Welcome to Endovision with Dr. Berger, your leading channel for insightful perspectives in the world of endocrinology. Here, we highlight the central challenges of our time: diabetes mellitus, obesity, thyroid disorders, and the essential role of nutrition for a healthy life. Subscribe to Endovision if you are ready to take your health to the next level. Here begins the path to a healthier, self-determined life.
Next, we want to work together on the most common causes of fatigue and exhaustion. Lack of sleep and sleep disorders. Lack of sleep is not just an obvious reason, but one of the most serious causes of fatigue. And often underestimated. Ignoring regular sleep times robs your body of the necessary recovery. Getting less than 6 hours of sleep per night leads to chronic exhaustion of your nervous system. But it's not just about the duration of sleep. Irregular sleep disrupts your body clock. Sleep disorders, sleep apnea, this often undiagnosed condition interrupts your breathing during sleep, sometimes hundreds of times a night. The result, your brain is not getting enough oxygen and you keep waking up without even realizing it. Insomnia, having trouble falling asleep or staying asleep, sabotages your body's recovery phases. Your body. Restless leg syndrome. Uncontrollable movements of your legs at night prevent deep sleep. Even 8 hours in bed isn't enough when the quality of your sleep is compromised. Chronic lack of sleep leads to an increase in stress hormones and a lasting impairment of your cognitive and physical performance. Stress and mental strain. Stress isn't just mental. It affects your entire body on a cellular level and is a major driver of chronic fatigue. Mental illnesses, depression, and anxiety disorders are not just emotional challenges, they directly interfere with your physiological processes. They exhaust your body through the constant overactivation of your nervous system, leading to insomnia, concentration problems, and persistent fatigue. Stress hormones. Chronic stress permanently raises your cortisol levels. Constantly elevated cortisol levels prevent your body from switching into relaxation mode. The result, insomnia, a weakened immune system, and a constantly overstimulated state. That feels like batteries that are never fully charged. Feels like burnout. Chronic stress that gets ignored can lead to a complete burnout. A state where mental and physical reserves are depleted. Poor nutrition. Your diet is the fuel for your body. But not every fuel is equally effective. Lack of essential nutrients. Iron deficiency. Without enough iron, your body can't produce enough red blood cells. The result, your cells get less oxygen, and you constantly feel weak. Vitamin D deficiency. This sunshine vitamin. It's essential for your energy production and your immune system. A deficiency often shows up as lack of motivation and fatigue. B vitamins. These vitamins are crucial for energy production in your cells. A deficiency shows up as mental exhaustion and concentration problems. Sugar and caffeine. Sugar gives you a quick boost of energy, but the subsequent drop in blood sugar leaves you feeling more tired than before. Caffeine might give the impression to keep you awake, but excessive consumption disrupts your natural sleep rhythm and causes long-term energy deficits. An unbalanced diet, one that's high in processed foods and low in fresh ingredients, doesn't provide you with the necessary building blocks that your body needs for energy production. Dehydration. Water is the foundation of your life, and even a slight lack of water can significantly impact your performance. Symptoms. Even a dehydration level of 1 to 2% of your body weight can lead to concentration problems, headaches, and general weakness. Why is dehydration so dangerous? Your blood becomes thicker, which makes your heart work harder to transport oxygen. Organs and muscles get less energy, and your body switches to energy-saving mode. Don't wait until you're thirsty. Plan your fluid intake consciously. At least 1.5 to 2 liters of water a day, more if you're active or it's hot outside. Hormonal imbalances. Have you ever considered that your fatigue might have hormonal causes? Hormones control every function of your body, and when you get out of balance, you feel it right away. Underactive thyroid. Hypothyroidism. A sluggish thyroid slows down your metabolism. This can lead to weight gain, sensitivity to cold, and chronic fatigue. A chronic autoimmune inflammation of the thyroid, Hashimoto's, can also cause fatigue even when hormone levels are balanced. Adrenal insufficiency. Acute adrenal insufficiency, Addison's disease, along with circulatory problems, immune weakness, and electrolyte imbalances, also leads to fatigue and exhaustion. Addison's disease is a life-threatening condition and must be treated by a specialist. Menopause, hormonal fluctuations, especially a drop in estrogen and progesterone, can cause sleep disturbances and a lack of energy. Hypogonadism in men can lead to symptoms like a drop in testosterone levels, resulting in loss of libido, muscle weakness, and fatigue. Chronic illnesses. Fatigue is often the first visible symptom of serious health issues, and it should never be ignored. Diabetes mellitus, blood sugar swings affect energy. High blood sugar hinders oxygen transport, while low blood sugar drains energy. Anemia reduces red blood cells, limiting oxygen flow. Anemia, a lack of red blood cells, means your body can transport less oxygen to your organs. The result is an all-encompassing weakness that doesn't go away even after getting enough sleep. CFS, chronic fatigue syndrome. This hard-to-diagnose condition leads to a state of permanent exhaustion that gets worse even after minimal effort. Those affected often feel trapped, since there are no clear healing methods. Fibromyalgia, with chronic pain hurts sleep and exhausts body and mind. Fatigue can harm. It affects your sleep quality and leaves you physically and mentally exhausted. Fatigue isn't always harmless. Pay attention to the following cardinal symptoms. Sudden, unexplained fatigue that lasts for more than 2 weeks, without any changes to your lifestyle. Accompanying symptoms like weight loss, fever, dizziness, or severe headaches combined with fatigue are warning signs. Extreme exhaustion, when it cripples your daily life and makes even simple tasks unbearable. Don't hesitate to see a doctor. Only through thorough tests like blood analyses, hormone tests, or imaging procedures can hidden causes be uncovered.
What diagnostic procedures will the doctor consider for the symptom complex? Considering fatigue and exhaustion. Medical history. First, a comprehensive medical history should be taken. Here, fatigue needs to be differentiated from exhaustion, since the specific diagnostics for exhaustion need to be much more extensive than for simple fatigue. The medication history is also important. Medications that can cause exhaustion must be identified. For example, beta blockers, antihypertensives, antipsychotics, sedatives. After the medical history, specific diagnostic methods follow. Laboratory diagnostics, complete blood count, electrolytes, liver and kidney values, blood sugar, HbA1c, and CRP, which are markers of inflammation, are considered the so-called basic blood tests. Special blood tests like ferritin and transferrin saturation, as well as vitamin B12 and folate, should be measured. If there's a suspicion of a hormonal disorder, TSH, FT3, FT4, TPO antibodies, ACTH, cortisol, BIAS, LH, FSH, androgens, and estrogen should be measured. NT-proBNP, or echocardiography. To rule out heart failure, it's also important to exclude serious heart conditions. Polysomnography can be used to diagnose sleep apnea. If these internal medicine examinations yield no results, patients need to undergo a psychological or psychosomatic evaluation.
Each of these causes deserves attention. Fatigue and exhaustion are not normal, and if they persist, they are a warning sign. Recognize the causes and take action, because your health is the foundation of your life. Anyone can go through a phase of fatigue or exhaustion in their life, even without a serious illness behind it. Then, it's important to fight your way back to your usual life. Here are some practical tips. To recharge your energy, it's time to take back control. Create a healthy sleep routine. Go to bed at the same time every day and wake up at the same time. Dark and quiet sleeping spaces, along with an hour of screen-free time before bed, work wonders. Pay attention to a balanced diet. Fill your plate with iron-rich foods, leafy greens, nuts, and whole grains. Cut down on sugar and unhealthy fats to a minimum. Exercise and fresh air. Even a 15-minute walk boosts your circulation and lifts your energy. Daylight regulates your biorhythm. Hydration. 1.5 to 2 liters of water a day is a must. Don't forget that coffee and alcohol dehydrate you. Stress relief. Practice yoga, meditation, or breathing exercises to calm your mind. Even 5 minutes of mindfulness can help you regain energy. Leaks. Intentionally schedule breaks into your day to avoid overworking. Your body and mind need this regeneration. Fatigue and exhaustion are more than just a feeling. Do we talk about the causes and warning signs and about how you can regain the energy you need? If this video helped you, then give us a like, subscribe to our channel, and turn on the bell so you don't miss any more videos. Share with anyone who might benefit from these tips too. Your health is your most important resource. Stay strong, stay healthy, and see you next time.